Hello, and welcome to the Dance Physio Podcast, a podcast designed to explore ideas and foster discussion around dancer health and wellness. We're here to challenge the status quo, bridge the gap between dance science and the studio, and help change the landscape of the dance industry for the better. I'm your host, Erika Mayall, a dancer turned physiotherapist who is deeply passionate about leaving the dance world better than I found it. I'm so glad you're here. Let's get started. Hello, everyone, and welcome back to another episode of the Dance Physio Podcast. I am your host, Erika Mayall. Before we dive into today's podcast episode, just take a minute to make sure that you are subscribed to the podcast so you never miss an episode. And while you're there subscribing, if you have not already, if you want to leave a rating or a review, that would be so helpful. It really helps other people to find the podcast who will also benefit from listening to it. So thank you so much for that. We are going to dive into part 2 of a question and answer podcast today. So a few weeks ago, we had part 1, and I had so many questions come in that I decided I needed to divide it into at least a 2-part episode. And this may actually become a regular thing, maybe quarterly, I'm not sure, going forward. But it does seem like there's a lot of people who have questions that they're looking for answers for. And a huge variety of types of people are sending questions in. So some from dancers, some from healthcare providers, some from parents. I love the variety. I think it's super helpful for everyone to be able to ask questions and get different perspectives and different answers. So if you have questions you would also like answered on a future podcast, please feel free to send them to me. You can DM me over social media at DancePhysioErika on all the major platforms, or send me an email. The email is in the show notes for this episode, and I will add them to my list. We're going to try and get through as many as possible on today's podcast episode, but not sure if we will because, like I said, I have quite the list of questions. So we're going to start and see where we get to, and I hope you find this useful. Oh, also, if you have not listened to part 1, I definitely encourage you to go back and listen to that one as well, because there were some really great questions. So yeah, if you haven't listened to that yet, listen to that one, but we're going to dive into part 2. And as always, I'm going to keep the questions anonymous. I know not everybody necessarily feels like their question needs to be anonymous, but I do think it's nice, especially for dancers who are maybe writing in and maybe feeling a little bit vulnerable in things that they're asking. I will always keep the questions anonymous as I am answering them on the podcast. So, like I said, send me your questions if you have things you want me to answer in a future episode. So we're going to dive in. Question number 1 was, is there an exercise to focus on to start dancing again after knee surgery? And I really like this question, partly because obviously this person is motivated to get back to dance, but I also think it's important for us to address questions like this because I think there is this idea that there's often like one specific thing that is like this is going to be the most important. Without having more information about, exactly what type of knee surgery it was or what the actual injury was in the first place, this is a little bit of an impossible question for me to answer, but I wanted to bring it up anyway because this is often the types of questions that dancers have a lot of possibly anxiety or apprehension around, and I think it kind of comes down to the maybe bigger question of like, will I get back to dance, or how do I get back to dance? So, like I said, without knowing anything about this person's injury or what type of surgery it is, this is a really hard question to answer because an ACL reconstruction of the knee is going to be a vastly different rehabilitation process than, a little scope where they've maybe just gone in to clean out some debris in the knee or something like that. So, really huge variety in what types of surgeries are being performed on the knee. However, that being said, our number one priority, or one of the number one priorities anytime we're dealing with knee injuries, but especially post-surgical knees, is to regain knee extension. And in dancers, that often means regaining knee hyperextension, because if you had hyperextension prior to the injury, we want to regain that same extension range after the surgery as well. So that is almost always our number one priority. And a lot of people, I think,
instinctively think that they really need to work on bending their knee, and we absolutely need to work on knee flexion as well, and bending the knee is obviously important for function. But in terms of how quickly we see people recover and how quickly we see people get back to normalized gait patterns and functional movement patterns, knee extension is really, really, really important. So that might be working on more passive knee extension type things, but if we're thinking about like from a strength perspective, our quadricep muscles, the muscles on the front of the thigh, are our primary knee extensor muscles. So really working on quad strengthening and quad strengthening at that end of range into full extension or hyperextension is really the number one thing that we need in order to gain functional movement back. And so although that's not, the be all and end all for returning to dance, if we have a dancer who isn't able to fully straighten or fully extend their knee, that's really going to hinder their progression back into dance. So again, without knowing tons of information about this question, that would be my answer, but it's going to be so nuanced for every dancer what the kind of most important or the biggest priority is. But generally, post-surgically, we want to go after knee extension really soon and really early after surgery and make sure that we're getting either full extension or, in most dancers' cases, hyperextension. So hopefully that is helpful to whoever sent in that question. Question number 2. Hi, Erika. I'm a seasoned physio, but recently relocated my practice and have started to see a lot more dancer patients from a local studio near the clinic. Your podcast has been such a helpful resource as I learn more about this specific population. My question is, do you have any other courses or resources you would recommend for healthcare professionals to learn more about specifically working with dancers? Thanks for any and all suggestions. Thank you for that question. This is actually a question I get a lot from healthcare providers or a lot of students as well. So physio students or chiro students or things like that who are maybe in school or getting really close to graduating and thinking about wanting to specialize in working with dancers. So I often get this question. So it is a really great question. I'm going to take a second just to plug some of my own resources. So I do have a lot of resources on my website. There's old webinar recordings and some PDF downloads and things like that. I will say that they are maybe more specifically for dance teachers, but healthcare providers, if you're willing to kind of read around the edges a little bit, a lot of times healthcare providers find those useful as well. But there are loads of other really great resources available specifically for healthcare providers who want to learn more about dancer populations. So my first piece of advice is often to look into some of the bigger organizations. So that would be something like IADAMS, which I've talked about lots on the podcast before. So that's the International Association for Dance Medicine and Science. We have Healthy Dancer Canada in Canada. We have the Performing Arts Medicine Association, so PAMA. Any of those types of associations, they often put on annual conferences. They have continuing education courses, like webinars, things like that. So I would definitely look at joining or becoming a member of some of those associations, or at least just checking out what events they have coming up, because that is a really great way to learn a lot of different information in a short period of time by attending those conferences and things like that. For more specific courses, because that was kind of what your question was, there are some online courses, and in-person courses available. So ones that I am aware of, I know that Pivot Dancer did a course that is hosted on the Embodia platform, all about working with dancers and other artistic athletes. So that would definitely be a course to check out for sure. I think it's available. It was offered live, but I think you can now take it on demand. And so it's broken into modules and stuff. I will put a link to all of these in the show notes for this episode. So if you're scrambling to write this down, or if you're listening to the podcast while you're out walking or running or doing something like that, I will put links to all these in the show notes. So the Embodia Pivot Dancer course would be something to look into. Lisa Howell is a physiotherapist based in Australia, and her courses are more aimed at dance teachers, but I will say she teaches at a level that is very, very, very applicable to healthcare professionals, and she has a whole host of different courses. She has some more kind of general courses, but she also has very specific courses on, like, say, turnout or the foot or flexibility or things like that. So if there's a particular thing you're looking to learn more about, Lisa Howell's courses are great. She does offer some of them online now, and then I think she's back to having some in-person ones in some places in the world as well. So that would be something to check out. Dance Medicine Education Initiative would be something to check out as well. They run in-person courses, and I believe they have online options as well. And these ones are, again, specifically designed for like a healthcare professional who really wants to learn more about what it means to treat a dancer or a performing artist, and broken into modules. So again, you can kind of take bits and pieces of it depending on what information you're looking for. So that's the Dance Medicine Education Initiative. The Harkness Center for Dance Injuries is a dancer health and wellness clinic that's associated with one of the medical centers in New York, but they have online resources as well. These are more bite-sized kind of webinar style courses. They used to, in past years, do an in-person, like kind of like a 2-day in-person course, maybe once a year or so. I haven't seen it advertised in a while. It may still be offered, but they certainly have some online resources. So they would be somebody to check out as well. And then if you're just looking for more like online learning snippets or things like that, the Library Aesthetic is a online platform that has contributors from all over the world from many different facets. So I full disclosure, am a contributor and do contribute some resources to the Library Aesthetic, but there's loads of other physiotherapists and Pilates instructors and mental health coaches and dance teachers. And it's a huge variety of information on this platform. It's a huge amount of content. Some of it is video content, some of it is written, some of it is audio, like there's podcasts and things like that. So it's something to maybe check out, again, just for very specific. If there's something really specific you're looking for, you might be able to find some resources. So it wouldn't be so much courses, but just kind of online resources. I would definitely check out that as well. So those are the ones that pop into my head sort of initially. There are plenty more. And so if there is something specific, like say, for instance, you're interested in learning more about like pelvic health in a dance population, like I know that there is a course for that. So there are some more specific courses, but those ones would all be a really good place to start. And then, like I said, certainly looking at some of the bigger associations, because they are going to have conferences and stuff where you can just learn so much information in, you know, a relatively condensed period of time. So hopefully that is helpful to you. I would also say, and this is not what your question was at all, but the other thing that I would add is really communicating with that studio. It sounds like you're maybe developing a very nice relationship with a local studio. And so don't be afraid to reach out to the studio owner and to the teachers at the studio and kind of like open a dialogue and say, hey, like, what are you guys looking for with support for your dancers? And, you know, they can kind of have some of that dialogue back and forth, because I know a lot of clinicians who maybe did not start out in the dance world. They don't have a personal background in dance, but they have developed really, really fantastic professional relationships with studios in their area and become kind of the go-to person in their area because they've been really open and willing to learn. And studios, dance studios and studio owners and teachers are often very receptive to healthcare providers who are wanting to work with that population. So I would absolutely lean on them for kind of direction and guidance as well. If you aren't sure exactly maybe what part of your skill set needs, you know, more work or things like that, absolutely start a conversation with them and sort of say, you know, how can I be of service, or what are you looking for as a studio? Because that definitely goes a long way as well. So hopefully that was helpful to you. Like I said, I will put those links in the show notes because I know that was a lot of different organizations referenced. We are going to move on to question 3. Hold on. Sorry, I just have to pull it up. Oh, there we go. Question number 3. I want to work on my extensions this summer. I know it's not just about stretching, and I likely need to do some strengthening, but I'm not sure what muscles to focus on for strengthening. Help. I love this question. First of all, because the help has a funny little emoji after it. It's like that one that's like, help. But I also actually really, really, really love this question because I love that this dancer has identified that they don't just need to work on stretching to get their extensions higher. So made my heart so happy when this question came in that we're really starting to see that shift in understanding within the dance world, that strength is such an important part of, well, all sorts of things to do with dance, but especially extensions and getting our legs up higher. So without knowing, again, a little bit more about this specific question in terms of, my first question would be, which extensions are you wanting to get higher? Is it extensions to the front? Is it extensions to the side? Is it extensions to the back? Because strengthening will be a little bit different depending on which extensions we're working on. So if we are working on extensions to the front or to the side as well, but to the front in particular, our hip flexor, our deepest hip flexor muscle, so our psoas muscle, is our primary hip flexor when our leg is above 90 degrees. So when we're working on our extensions getting higher. So that would be the muscle group that we want to spend a lot of time working on. But oftentimes with extensions, one of the things that's missing from a strength perspective is enough strength and stability through the trunk and the pelvis area. So like through the core area in particular. And so what we see is dancers end up compensating for a lack of control in that area. So before we start to actually just fully focus on strengthening the hip flexor muscles, we want to make sure that we have a good base of support for those muscles to be able to work off of. So it may mean working on some trunk stability and kind of core exercises and things like that. But then we want to work on strength of those hip flexors, and particularly at more end of ranges. Or throughout range, I guess I should say. It's not just end of range, but we need to make sure that we're working through range. Because what I often see is dancers are like, oh yeah, I've been working on strengthening, XYZ, whatever muscle group it is. But when you look at what exercise they've been doing, they've only been working in like what is often like a mid-range area. So they haven't worked at the kind of two extreme ends of range. And for something like our hip flexors, we need our hip flexors to be able to work through a really large range of motion. If we think about, they need to be able to control an extension, so they're stretching if our leg was like going behind us, or if it was the back leg in our split or something like that. And then they need to be able to have that end range control into like a full our leg going to the front, whether it's a kick or a développé or whatever the movement is. So that is one of the things that's often missing when dancers are working on leg height programs, is they're not working throughout a full range of motion. So that would be one thing to focus on. If we're thinking more about extensions to the back, so more kind of arabesque type moves or those types of movements, it's a little bit different because we have the movement that's happening from the actual hip or the actual leg part of the movement, but we also have the back involvement. So when we're looking at getting our legs higher to the back, the movement is not coming solely from our hip joint or our hip socket. It is anatomically impossible. So at some point, the pelvis and the back actually have to like play into that movement as well. So we're often looking at glute strength. If we're thinking about the leg or the hip part of extension, hip or the glutes are our primary hip extensor muscles. So strengthen the glutes for sure. But we also can't neglect or forget about the pelvis and the back component of it. So depending on where limitations are coming from or where a dancer is potentially lacking strength, that may be an area that we're focusing on as well. So like I said, without knowing a little bit more about specifically which extensions you're really wanting to improve or sort of prioritize, it's a little bit tricky to answer this question, but those would be the primary things to focus on. But like I said, love this question, and I love that you're already thinking about, okay, I need to work on strength and not just stretching, because already you're going to be, miles ahead than somebody who's just kind of sitting in the splits all summer and hoping that that translates into their extensions being higher when they go back to dance in the fall. So great job, and hopefully that is helpful, and you can start to think about some of the strengthening exercises you might be able to add into your program. Okay, moving on. Question number 4. Sorry, just looking. Oh, there we go. Question number 4. Hi, Erika. This might be a bit of a personal question, but I'm curious. Given everything you know about the dance world today and your personal and professional experiences in it, would you let your own child dance? This is a great question. And for those of you who don't know, so the listeners out there who maybe don't know, I have one child. I have a 9-year-old son, and he does not dance. And that is primarily because, or is solely because, he has never wanted to. So there's been many, many, many times over the course of his life where I have offered dance as an option for an activity, or, there's been lots of opportunities for him to try it. He's certainly exposed to dance. He comes to dance performances with me. He's around the clinic a lot. He's very familiar with dance. He has never, ever, ever wanted to actually participate in it himself, no matter how much I've tried to encourage him. So he does not participate in dance, but that is his choice. That has nothing to do with my feelings of the dance world or anything. So this is a bit of a loaded question, and it's not too personal. Don't worry about that at all. But I get where you're coming from, because I can see that for some people, especially people who have had potentially negative experiences in the dance world, where they would be very hesitant to put their own child in that position, or, kind of subject their own child to that. I have been very fortunate in that my experiences in the dance world have been largely positive. So I did not grow up in a particularly abusive dance environment or things, but again, I was not really competing, and certainly not to the same way dancers are nowadays. So I understand that, the dance environment is different nowadays, and there are certainly still large issues with it in a lot of parts of the world, but I truly think there are so many benefits of dance that I would absolutely let my child dance if it was something he was interested in doing, or if I had a child who was interested in dance, I would absolutely let them participate. I think the benefits of dance, just in terms of what it teaches us as a human being, so not even from a dance perspective and from the perspective of somebody wanting to go professional or make a career out of it, but just things that it teaches us, from a physical perspective, just physical literacy and body awareness and strength and control and flexibility and all of those things. There's so many benefits from that perspective. But I also think it teaches kids, or just people, a lot about motivation, and a lot about teamwork, and a lot about perseverance, and a lot about, I certainly learned how to set goals and work hard towards those goals and things like that. There's so many things that dance can teach us that are above and beyond what it teaches us from a physical capacity, and just in terms of having well-rounded humans. I think the musicality part of dance is really important for kids who are often not getting a ton of music education in public school systems anymore. So I really, truly believe that dance teaches us so much more than just dance. And so I would absolutely encourage my child to participate. But I would be very, very particular about where they were training and the types of, the type of training environment that they were in. Most of you, if you listen to the podcast regularly, are probably aware that there is no regulation within the dance industry. And we've done an entire podcast episode on that. I will link that podcast episode in the show notes as well. So if you haven't listened to that and you're kind of curious about more of that, I will link that. But there's no regulation within the industry. So the onus is on parents to do their due diligence to really research what environment they're sending their kid into. And I feel really privileged to be in a position that I actually know a lot about the dance industry, and I know a lot about the local dance industry around me, that I know that there are a lot of environments that I would be very comfortable sending my kid into. But you have to do your research. You want to find out about the teachers that are there. What are the values of the school? What are what's kind of the program setup? Is it a competitive program? Is it more of a performance training program, and all of those types of things? So I think for the average parent, that's sometimes overwhelming, especially if you're a parent who doesn't understand the dance industry. If you don't come from a dance background, it can be really challenging to kind of learn that stuff on the fly as your kid is kind of immersed in the dance world. So I do feel privileged to have a little bit more awareness about what I would personally be looking for in a training environment for my child if they chose to dance. But yes, to answer your question, I would absolutely allow them to dance, but I would be picky about where I would allow them to train and what type of program I would put them in an effort to minimize some of the negative things that are still unfortunately happening in some areas within the dance industry. So hopefully that is helpful. Like I said, I will link episode, I believe it's episode 30, but it's the regulation in the dance industry episode. I will link that in the show notes for people who are curious about learning more about the lack of regulation in the dance industry. All right, next question. Sorry, just looking down my list. Would you recommend a hyaluronic acid knee injection for a teenage dancer if necessary? And this is a super interesting question. So for those of you who don't know, hyaluronic acid is a lubricant of sorts that is often used in people who have osteoarthritis in the knee. And it is meant to mimic we have fluid in our joints that's called synovial fluid. That's kind of like the lubrication within our joints. And hyaluronic acid is meant to mimic that. And so this is something that's used when people have degeneration or arthritis in a joint. They will sometimes use this injection to try and kind of lubricate the joint, give it a little bit more cushioning, and decrease people's like pain and, like functional limitations from that. It's something I've had lots of clients in the past when I worked with more of the general population. It was something I saw pretty frequently in people who were probably eventually going to be candidates for a knee replacement, but they will often try these hyaluronic acid injections first to try and almost like buy the patient a little bit more time. And so the people who responded well to them often respond really well, where they might get anywhere between like 3 and 6 months of really, really good pain relief. And so they can be really active and keep, being functionally active during that time and sort of delay what is probably in their case, inevitable process of needing a knee replacement. So it is not something I have ever seen in a teenage population before. I believe in Canada, it would be considered an off-label use, just in the sense that I don't think it's actually like been approved for use in like teenagers or adolescents. I could be wrong about that. I've not looked into it super closely because, like I said, I've never seen it in a teenage population. So that's one thing to consider. So the question is like worded, would you recommend? And so my answer to that question would be no, because as a physical therapist, we are actually not allowed to like prescribe things like that. So hyaluronic acid would be considered a medication. It's an injectable, like it would be injected into the joint. And that is outside of my scope of practice. So my question in this case would be, who is the person who is recommending it? Because it would likely be an orthopedic surgeon who would be suggesting this as a possible like option for this dancer in this case. So, the direct answer to that question is no, I would never kind of prescribe or recommend it. But, looking a little bit more at like opinions about, would this be like a reasonable thing to recommend? I don't actually know a lot one way or another. Like I said, I've never seen it in a younger person. It's always been in people who've had more advanced stages of osteoarthritis where I've seen it used in. And then my biggest question, I don't know if concern is the right word, but my biggest question would be, what is the underlying issue that this injection would be trying to address? Because if there was, say, a traumatic injury in the past that had caused some damage within the knee, and then they were just looking to try and provide some relief and settle down the symptoms or whatever, this might be a very reasonable treatment option for a younger dancer. If, however, this is an issue that is being caused by potentially like an underlying biomechanical cause or something that's causing like I'm going to use in quotations like wear and tear within the knee joint, doing an injection becomes very much a Band-Aid fix if we're not addressing what the underlying issue is that's caused the problem in the first place. And like I said, if it was a one-off traumatic event, so it's not something that's an ongoing issue, then this might be a reasonable kind of treatment choice. But if this is just like a little bit of a shot in the dark to say, hey, maybe if we inject it, it'll feel better, but we haven't addressed the underlying issue, then to me, that's really just a Band-Aid fix and is maybe not the most reasonable or the best choice of action in terms of like treatment choices. So again, this is like not a super definitive answer for you, but I thought it was an interesting question because, like I said, I've never seen a hyaluronic acid injection in a adolescent population before, and it may be considered an off-label use of it. I'm not totally sure, but those would be my questions: is who's the person who's recommending it? I would assume it's going to be an orthopedic surgeon, and then also, for what reason? Like, is it more in response to something that was a one-off trauma, in which case maybe. If it's more of like a biomechanical issue or something like that, then I'm not sure that it would be the most successful treatment course of action. So hopefully that is helpful for you and gives you a little bit more information about it. And hopefully listeners maybe learned a little bit of something about hyaluronic acid knee injections. All right. I am aware of the time. I don't want to make this episode too long, but I am going to answer one final question on today's episode. So the last question we will get to says, does your body actually heal from things like plantar fasciitis, or is it more about managing it? This is a great question. And I think one of the things we have to consider is what it is that we're doing to allow the body to heal. So short answer, yes, our body absolutely can heal from these types of things. The longer, maybe more nuanced answer is that something like, for instance, plantar fasciitis, a lot of people are maybe... I'm just trying to think of how to word this right. A lot of people with these types of injuries and these types of recurrent things go through these cycles of like, it flares up, it gets more sore, so then they rest it and they sort of just like unload the area. It feels better, but they don't really do much other than sort of unload it and rest it. It feels better, so then they go back to the activity, it flares up again, and then they rest it again, it feels better. And we kind of get into this cycle where, yeah, maybe it would feel more like you're just kind of like trying to manage the symptoms, but it's not truly healing. So what we need to consider in situations like this is that simply unloading or resting a tissue does not necessarily allow it to heal. Different tissues in our body, and we've talked about this lots on different episodes when we've talked about tendinopathies and things like that, but most tissues need some sort of graded loading response to actually adapt. So the way our tissues adapt and heal in our body is by us challenging them. So we're like sort of loading the tissue or overloading the tissue in a way that it challenges the tissue. And then we get a healing response. It adapts to that overload. And then we kind of continue that cycle. And so what we often see, and especially in something like plantar fasciitis, is that the approach that people take to sort of trying to treat it or trying to manage it is that they actually unload it a lot. So it'll be like, okay, let's spend less time on our feet. Let's put a lot of really supportive inserts into our shoes. Let's, wear compression socks, like all of these things that are maybe more aimed at unloading the tissue or supporting the tissue, which can be helpful for symptom management and absolutely is necessary sometimes for pain management and symptom management. But long term, if we're truly looking at how do we get this tissue to adapt and heal, we actually need to look at loading it and allowing the tissue to have that healing response time and gradually increase in its capacity over time. We also, in a case of plantar fasciitis, want to look at the underlying issue. Like, what is it that's causing it? Because sometimes there can be an underlying structural issue within the foot that might predispose somebody to developing this type of problem. And so if that is the case, then we may actually be looking at things like an orthotic or things that are maybe more aimed at management as opposed to truly like healing the issue. But even in those cases, a lot of the time, especially if somebody like develops this issue kind of, I don't want to say out of the blue, but it's like they functioned fine for 20 years of their life without any problems and then it developed. It's unlikely that it's related to like the structure of their foot, for instance, or things like that, because they've probably had that structure for your entire life. So oftentimes we need to be looking at the underlying cause. So is there a biomechanical issue? Is the plantar fascia compensating for something that's happening higher up the chain and things like that? And if we don't address those underlying causes, then yes, it becomes much more of a management issue than a true healing issue. But given the right environment and the right circumstances, our body 100% is capable of healing. It's just a question of addressing the underlying kind of cause or issue, and then in this case, appropriately loading tissues so that they are able to adapt and actually heal. So the body is really, really smart, and when given the right environment, it will be able to heal. So to answer your question, yes, we can heal from things like this, but oftentimes in the dance world, it probably feels a little bit more like management just because some of the things that we might need to do to truly be able to heal from these injuries might be a little bit prohibitive while we are still dancing, especially if you're dancing professionally or something, because we might not be able to manage the training loads and stuff as exactly as we would want to really be able to promote healing within those tissues. So then sometimes it does become a management thing, or at least a management thing for a period of time until we can get that dancer to say like an off season. And then it's like, okay, now we're going to actually truly work on like healing the problem. So sometimes it's a little bit of a combination of both, but yes, our body absolutely does have the capacity to heal. So great question. I loved all of those questions today. Once again, thank you so much to everybody who sent in your questions. I will, like I said, keep a running tally of all the other questions. There's still some more that we didn't get to today. So there will be a part 3 at some point, probably not as soon as this episode is coming out compared to part 1. So like I said, I will look at making this a regular thing, but maybe once a quarter or something like that. So please send me in your questions. I love to hear from all of you. And if you have a question, chances are somebody else does too, or somebody else will learn from that question as well. So send me your questions and we will do a part 3 sometime probably in the early fall or something like that. Once again, thank you so much for listening. I really appreciate your support, and I hope you all have a great rest of your day.